My name is John Anthony Herring. I used to go by Tony Herring, and I am currently the Chief of Staff Emeritus of the Texas Scottish Rite Hospital for Children, and I have been here at Texas Scottish Rite Hospital for about 37 years now. I think several things distinguish our textbook from other textbooks in the field. I think, first of all, it is clearly the most comprehensive textbook. We have 3 large volumes, and in this edition, one of the volumes will be online only, and all 3 volumes will be available online, and 2 volumes will be available in print. So with this size of a publication, we can serve both the early reader who wants to get the essence of the problem and the serious person in children's orthopedics who really needs an update or finding some particular information that they need, and finally also as a resource for research. And our bibliography is about the most comprehensive bibliography that you can find in pediatric orthopedics. So I think we serve the whole field well with this textbook, and can consider it to be the authoritative text within the field. Another thing that distinguishes this textbook from others is our extensive use of videos. In the prior textbook, we've had a number of surgical videos, and in this textbook, we've not only enlarged that considerably, but we've added videos having to do with physical examination, videos to do with explanation of disorders, and other non-surgical videos, which I think are a very great addition to the text. And this textbook will now have almost twice as many video productions as the previous text did. I meet people from all over the world who tell me how valuable these, especially surgical videos, are for their surgical planning and surgical carrying out of pediatric orthopedic operations. Some saying they project them in their operating room while they're working. And with these videos, we've tried to make them very typical of a surgical procedure. We do the narration and we do the entire surgical video in one sitting, so that you're really looking at a given operation as it's being done, and we can show you not only the easy parts of the operation, but the more difficult parts. We feel that this book really can serve almost every audience in pediatric orthopedics, from the resident just rotating onto a pediatric orthopedic service. That person can really go through a chapter and pick the parts they need and get summaries in the bullet points and come out of it really well prepared for their work in children's orthopedics. We also feel it's an excellent reference for the practicing pediatric orthopedic surgeon, and a very good reference for those who are writing in pediatric orthopedics and doing research, because our bibliography is so extensive and our coverage of the topics are so extensive that I think the full-blown academic pediatric orthopedist can get a lot out of using our textbook. In our work with the Tachdjian textbook, we've had excellent relationship with the Elsevier company. They've been very, very helpful in the aspects that are difficult, the artwork, the video preparation, editing the text, and have been very responsive and very effective to work with. I think they're doing an excellent job of promoting our textbook and letting others know the extent to which this is an outstanding text that should serve their needs. I would summarize my discussion by saying I really appreciate all the hard work that's gone into preparing this textbook. Our authors have to work very diligently and find time among their busy schedules to put the time in to make this an outstanding, really state-of-the-art textbook that it has always been and that it will continue to be. And so I appreciate very, very much everyone's input into this. And I appreciate the feedback from the readers of the textbook, who will occasionally tell me things we've gotten wrong or things that we've omitted. And hopefully we've pretty well taken care of those over our last 3 editions.